So straight away, I'll request Charulatha to start her presentation.
The screen. Okay. Thank you, everyone. I'm looking at exploring multi-sector programming at the subnational level. It is a synthesis of 6 case studies that the Emergency Nutrition Network, or ANH, did between 2017 and 19. And this is the entire team of which I was a part, which did these studies. So we looked at 6 countries, all of whom have signed up to the Scaling Up Nutrition movement. And in the first round, we looked at Senegal, Nepal, and Kenya. And in the second round, which we've just concluded and not yet published, is Ethiopia, Niger, and Bangladesh. The frameworks in place of the 6 countries, 3 countries which are highlighted in blue, Nepal, Ethiopia, and Bangladesh, were already in the second phase of multi-sector programming at the level of the country. They already had policies in place, whereas the other 3 countries were, like in Kenya, they were just about reviewing to put a policy in place, and in the other 2 countries, they were still in the first phase of policy development, multi-sector policy and programs. So we looked at specific programs in each country. In Senegal and in Kenya, it was external development partner funded programs at a smaller scale, whereas in Nepal and in Bangladesh, it was the government framework, the multi-sector framework, which we examined, looking at how much it was rolled out at the subnational level. In Ethiopia, it was what was called the Sekota Declaration in 2 regions of Amhara and Tigray. So how we do our work is really through a series of interviews. We looked at 2 districts, 2 sub-districts in each country, a series of stakeholder interviews looking at the health sector, looking at speaking to officials from all nutrition-sensitive sectors, speaking to implementation partners, NGOs, CBOs on the ground, and local government representatives and frontline staff of all sectors. And through our 6 studies, we found various types of multi-sector nutrition adaptations. 2 types were where they converged on nutritionally vulnerable households or 1,000-day households, or at the level of the village or the commune, like ag and wash coming together. And the other was using the nutrition, either sensitive platforms to give nutrition messages, like farmer schools incorporating nutrition messages, or through nutrition-specific platforms introducing messages on hygiene and social protection, or through nutrition-sensitive sectors slightly modifying their programs, like ag introducing biofortified seeds, or social protection modifying their handout package. Our key findings, one was that multi-sector programs to be rolled out are extremely time-intensive. There is a lot of lead-in time that is necessary for each of these programs, irrespective of the scale of implementation. Like in Bangladesh, for example, they set up subnational level district and Upajila nutrition coordination committees, even before they quite figured out what exactly these committees would do. Whereas in Ethiopia, they invested a whole year in actually planning how subnational rollout will happen. So there were 2 countries taking 2 different approaches. Now, the amount of time taken for such a program has definite implications for donor cycles, where especially if donors have shorter than 3-year cycles, and also because demonstration of impact is very difficult. And we also saw that the way the policy is going to be rolled out, or the framework is going to be rolled out, and the organization of a multi-sector program within the country, the architecture, the nutrition architecture within that country became very, very important as to where is the location of the national coordinating body. It was ideal if it was independent of a sectoral ministry, like we saw in the National Planning Commission in Nepal, and the Federal Program Delivery Unit in Ethiopia. But most often that was not the case. It was often situated within the health sector. In some countries, very few, agriculture was the lead sector. And we also saw that a political face or political will is just not necessary at the top level. It had to percolate down to every level, including up to the level of the local government. coordination was identified across 6 studies as the key challenge and the most time-consuming activity. And of that, intersectoral coordination. Now, government ministries which have a history of coordinating well continue to, seem to be the most pliable or more flexible to coordinate. And another important thing was that there has to be an appropriate level of seniority across sectors. I mean, you can't have a junior secretary speaking to the chief secretary of 2 different sectors. There had to be parity when people were appointed to participate in multi-sector meetings. And targeting criteria and different levels of work made alignment very difficult. For example, to coordinate with education, for an education department, their focus is really schools as a unit, whereas WASH would be looking at entire villages, and the health sector is looking at, primarily mothers and children. So what is the common unit that they are looking at? That sometimes made alignment very difficult. And dedicated resources for coordination are imperative, but who is going to foot the bill? That was another very major challenge which was identified. And of course, multiple parallel coordination meetings. People were just so tired of attending meetings after meetings. And people, like in Bangladesh, the district administrative head is, I think, 3 to 4 is the lower. He attended sometimes as much as 10 meetings in a day, and by the end of the day, he couldn't care less what meeting he was chairing. So it was really a big challenge. And coordination increases many-fold, with sometimes the purpose of a multi-sector program becoming just coordination, not why the coordination is happening. What is the larger purpose of the coordination? Communication and capacity development were another 2, things which really needed to be looked at differently within multi-sector programs. So how multi-sector programs were being communicated. Like in Nepal, we had what was called in Nepali the Sunola Hazar Din, that is the Golden 1,000 Days program. This was a buzzword that we heard during field work right from the national level at every sector down to the last mother we spoke to in the 2 districts. And zero stunting by 2013 in Ethiopia. These were 2 campaigns which had really kind of caught on, and that is really important, which leads to increased awareness across sectors, across all levels of governance. But that has to be accompanied by capacity development, which is really a prerequisite for nutrition-sensitive sectors to buy into a multi-sector program, and to identify what is the minimum that is necessary within this capacity development package. That's really important. But again, this whole process is very resource and time intensive. But unless we do that critical step, we can't create ownership, and we will not be able to achieve coordination. So sometimes we're coming back to coordination, but that's not the end all and be all of multi-sector programs. Devolution, most of these countries are going through a phase of devolution. There are many opportunities that it presents, but there are also challenges. It has enabled ministries to engage from within their sectoral remits, but come together in a shared space. But there were some challenges because there's very limited capacity at the lowest level of governance, often on technical issues, and changed hierarchical relationships with bureaucrats now almost, reporting, so to say, to newly elected political person, and elected representatives, of course, having completely different ideas about what they want to do in their limited term of 5 years. And this probably is a very critical finding which we saw. The ultimate aim of all multisectoral programs is really delivery of a package of services at the household level towards reduction of stunting. That is what we all want to do. So this requires a shared definition of a vulnerable household and a common beneficiary list. But this was seen only in 2 countries, but not at scale. One is in Ethiopia through a mechanism called the community labs, which is basically a group of people at the lowest level, at the Kebele or the village level, coming together to create a shared beneficiary list. And Nepal, the joint monitoring visits or the model villages. Monitoring and evaluation. The value add of a converged and a coordinated approach is yet to be quantified. There are huge barriers to development of a joint M&E framework. So different sectors measure different things at different intervals in different ways. The health sector, most often in all countries, is the most uniform MIS. And donor-driven or partner-driven MIS is what we see. Subnational systems are severely short-staffed. So who is going to collate the data? How are they going to send it up? And there is almost never a system of feedback, even within sectors. Costing and funding. So what multi-sector programs bring in additional costing? What are the additional costs? Coordination is costly, cross-sectoral capacity building is costly, and communication which has to be tailored to various audiences. And I see that, I'll just get to my next slide. And most of these programs were fully costed, but they were not fully funded. So this is just the last one. So within our case studies, we did not look to offer really recommendations. We said what remains unanswered, what needs to be done yet. What is this essential package of services that needs to be delivered through a multi-sector program? How do we arrive at a common definition of vulnerability which is understood by all sectors and acceptable? Who should ideally lead a multi-sector program? What is in it for a nutrition sector, sensitive sector? Why should they buy in? And to that, I relate the last question. Do we really know how to communicate convincingly on the criticality of nutrition outside of this echo chamber? We all understand it. Do we know how to communicate outside of it, especially when nutrition science is continually changing? And how do we measure the impact of multi-sector programs? Thank you. And I request you to all go back to our ENN website where there's a wealth of resources around nutrition. Thank you.